the biggest misconception about Medicare is that it covers everything. Okay. But Medicare does not cover everything. There are some things that are not covered. We have a lot of clients that get their Medicare card in the mail and they say, "Oh, I got health insurance now." Well, they do, but there's deductibles, there's co-insurance, there's no out-of-pocket max that they have to meet. So there's a lot of hidden cost behind that.
Welcome to the 2026 Faces of Riverside magazine's conversation series, where we get a chance to sit down and talk to the individuals that are profiled in the magazine to dig a little bit deeper into their organizations, the services they provide, and really their overall mission for doing so. Today, we are joined by Henry Romero from HRBC Insurance here in Riverside, and we're excited today to learn a little bit more about some of the very complicated parts of Medicare and health insurance for older folks, as well as covered California and some of the other services that they offer. Henry, welcome.
Hey, Norm. Thanks for having me.
My pleasure. Before we kind of dig into some of the meat of this, I want to give you an opportunity to kind of introduce yourself a little bit and tell us a bit about your background. I know that you've been doing this with HRBC for 20 years, 20 plus years, if I'm not mistaken. You can correct me if
Yes,
I'm
sir.
wrong. But your journey started before that. So you want to share with us a little bit about your background and why folks should be listening to you in the first place?
Absolutely. Thanks for the opportunity. So, as you know, I'm the founder of HRBC Insurance, and we've served our community here in Riverside for over 20 years this past December. So, I started my career at Kaiser Permanente when I was a young man. That was a long time ago. That was in 1985, where I gained firsthand experience on how healthcare worked from the bottom to the top. So, we focus here at HRBC Insurance on doing the right thing, leading with compassion, humility, and truly seeing what people need. So I retired from Kaiser, started HRBC Insurance so that we can help companies, cities, individuals with their Medicare or covered California needs.
Excellent. Do you have other locations, or are you headquartered just here in Riverside?
So we have our corporate office here in the beautiful city of Riverside on Magnolia. For those of you that know, we're right up the street from Dairy Queen. That's kind of an iconic location,
It is.
right? But we also have a flagship location in Fontana. We have an office in Orange, but we do have satellite agents from San Diego all the way up to Fresno and Madera.
Okay, so in terms of insurance in general, is Medicare the primary focus for HRBC?
I would say it's a large insurance side of the business since 2006. So we do focus a lot on Medicare education, helping individuals, whether it's a Medicare Advantage plan, Medicare Supplemental plan, prescription drug plan, working with their local doctors, specialists, hospitals. There's so much more that goes into Medicare than just signing up for a plan. But yes, Medicare is a big focus for us.
Okay, so that's an important point. One of the things that I think most people can agree on is that Medicare and health insurance in general can be confusing. And a lot of folks may find themselves making a decision based on price first, when it really should be about understanding the different types of options that are out there first.
Correct. So I think a lot of people buy based on price, but price isn't everything. You know, when you go to the store, when you buy, whether it's a cell phone or whether you buy a subscription, there's a lot more that comes to it than just price, right? So we dig deep. We look at the benefits. We look to make sure that your doctor's covered, your specialist is covered, your prescriptions are properly covered. Because when we jump at price, and don't do the research properly, we can get hurt in the long run by not knowing whether I go to Riverside Community Hospital. Can I go to Parkview? Is my metformin covered? Is my Januvia covered? So those are really important benefits that we do the research for the member.
Okay, so let's just say, Henry, that I'm turning 65 years old. I'm approaching Medicare for the first time. Where do we even begin?
So there's a lot of questions. That's a loaded question because some people turning 65 do retire. They do go on Medicare. A large portion of our population, they'll continue to work. So what do I do? So there's a lot of confusion. Well, I hear about penalties. I have to sign up for Part B. I have to sign up for Part D. But that really depends on whether Norm is going to continue to work. Does your company offer a credible coverage plan? Right? So if I'm on a credible plan, then I may not have to apply for Part B and D. So those are the things that we help you navigate through. And again, our core value, number one core value is always do the right thing. So if Norm is going to continue to work for the city of Riverside for 2 more years, and probably the best thing for you is to stay on the company plan and wait 2 years to apply for your Part B and your Part D. So it really depends on your individual situation, but those are the things that we help uncover. And we can do it in a group setting. We can do it independently with you at your home or here at our office.
So when you mention group setting, what does that look like?
Work setting, can you mean by that?
Well, you said a group setting. Um, yeah.
So we provide what we call T65 dinner meetings throughout Southern California. So if you happen to go to one of our T65 dinner meetings, you get all the information on Medicare A, B, C, D, Medicare Advantage plans, Med Sup plans, Part D plans, Tax. What does it cost to get the Part B? So you get all the information that's needed to make an informed decision moving forward. And then we offer individual appointments to move through that process.
Okay. Okay, that makes sense. So, in terms of Medicare as a whole, is there such a thing as a big misconception people have about Medicare?
I think the biggest misconception about Medicare is that it covers everything. Okay. But Medicare does not cover everything. There are some things that are not covered. We have a lot of clients that get their Medicare card in the mail and they say, oh, I got health insurance now. Well, they do, but there's deductibles, there's co-insurance, there's no out-of-pocket max that they have to meet. So there's a lot of hidden cost behind that. Um, and then a lot of people don't apply for a Part D. So they don't have drug coverage because they assume it comes with it, or maybe they're not taking drugs at 65. So if Norm is turning 65 and you're perfectly healthy, you don't need prescription coverage, right? Then those costs bite you in the butt when you actually need the coverage and apply for it because now there are penalties. And these are lifelong penalties that you have to pay. There's ways around that, but then you would have to speak with, one of our professionals to figure out how do we navigate that playing field so that we can benefit the most.
Okay, that makes sense. So you mentioned certainly I've had issues or dealt with Medicare Advantage plans as it relates to my aging mother. Can you help clients kind of understand the difference between basic Medicare and Medicare Advantage and supplements and some of the other options?
Absolutely. So we always teach that there's 3 different roads you can take. You can take road number one, and that's your original Medicare. That's Part A, Part B. You have your hospital coverage, your professional coverage, which is doctor, specialist, lab, X-ray, MRIs, etc. So you can definitely go that route, but then you have deductibles and 20% coinsurance. And then you have to pick up a Part D drug benefit to go alongside of it. But that's perfectly fine. And that works for a very few percent of the people that we help. Now, the second road leads you down Medicare Advantage. So the Medicare Advantage option, which is also known as a Part C, okay, like CAT, the Medicare Advantage plans, Now, those are typically like an HMO. Okay. So, in HMO, you have to pick a primary care physician. They refer you to your specialist. They schedule your outpatient surgery, inpatient surgery. So you have to go through a referral process. So you sign up with a Medicare Advantage company, and there's many of them out there. And with so many companies comes so many different products because they don't offer one Medicare Advantage product. Some offer 10, 13. So now you have to know, do I have a chronic condition? Do I have Medicare? Do I have Medicare and Medi-Cal? What other coverage do I need? Do I need dental? Do I need vision? Do I need a gym membership? So there's a lot to navigate through. So that's road number 2. Door number 3, that's a Medicare supplemental plan, which is also known as a Medigap plan. So these are plans that are put in place by the government, Plan A, M, G, F, and the benefits are identical. The only difference in a Medicare supplemental plan is the logo on your ID card and how much you pay for it. That is pretty much it. So the major medical companies offer it: Anthem, Aetna, Blue Shield, United, HealthNet, Humana, so on and so forth. So we help you navigate through that process so we can find you the plan that's going to be the most affordable, but also provides the proper coverage that you need. So, but with the Medicare supplemental plan, unlike the Advantage, I like to call it a PPO on steroids because it doesn't really have a network other than a doctor, specialist, or hospital that contracts with Medicare. So you can go to any doctor, specialist, hospital in the country as long as they contract with Medicare. And most companies do, right? So if you wanted to see a specialist at Hope or Cedars or City of Hope, you just pick up the phone, make an appointment. That's that's the beauty of a med sup. But in addition to your Part B premium of 202 a month, they charge a premium. And they start at about $170 a month when you turn 65, and they go up from there as you age. So your mom, how old is your mom, Norm?
89.
Oh, bless her heart. Okay. She's 89. She's probably paying about $350, $380 for her Medicare supplemental plan because they do go up as you age. So those are the 3 different types: original Medicare, Medicare Advantage, and a Medicare supplemental plan. Oh, and
Okay.
the Part D, the prescription drug portion.
Okay. Okay. So, Henry, can I change the road I'm on?
Absolutely. Let's go.
So, well, in terms of the you just identified 3 different paths that you can take. If I decide that I want to go with path number 1, which is the basic Medicare, if I understood you
Sure.
correctly, I am, as you well know, bombarded every year towards the end of the year with offers for Medicare Advantage plans. I make a determination after a year or 5 years that I want to take advantage of one of those plans, pun intended, instead of staying on the original Medicare?
Yes, you can absolutely enroll on a Medicare Advantage plan during the annual election period. And you're referring to October 15th through December 7th, right? So that is, when we work, we have open enrollment. So for people on Medicare, this is your open enrollment, but the government calls it the annual election period, where if you have original Medicare, whether you have Part D or not, you can enroll on a Medicare Advantage plan, guaranteed issue. All you have to do is sign the application and the company has to take you. Doesn't matter if you have a chronic condition or not, you will be effective January 1st of the following year. So you can definitely take advantage of a Medicare Advantage plan every year, any year, until you decide to enroll in one.
So I have heard, and I asked this question with a clear understanding that I don't necessarily understand all the details of the different options that are available to me. I've heard there's some issues with the Medicare Advantage plans. And one of the things I had heard, and this would be great insight for me and probably for anyone listening, is that I may have a relationship with a hospital, with a doctor as my primary care and so forth when I'm on path number one, when I'm on basic Medicare. Do I potentially have to give up those relationships if I switch to Medicare Advantage? And do they have an ability to determine if I'm eligible for certain things that may be different than what Medicare deems me to be eligible for in terms of treatments and so forth?
Sure. So in most cases, your provider will have a contract with a what is called a medical group or IPA. So as long as that medical group and IPA contracts with the carrier, then you can keep your doctor. Now we look up the primary care physician and then we look up the specialists to make sure that those specialists belong to the same group. If they do, then perfect. You don't lose any of your relationships. Now, it is fairly common that maybe one out of your three specialists may not be with the same group, at which point you need to make a decision. Do I benefit more from enrolling on the Medicare Advantage plan, keeping my PCP or primary care provider and two of my specialists, and then finding a new cardiologist, oncologist, podiatrist, right? So those are some of the hard decisions some of our patients or clients have to make, but it's not that common because most of the groups here, whether it's Regal, Optum, those are the two largest in the area, right? You got Riverside Medical Clinic, but that is a staff model. So you don't run into that issue with Riverside Medical Clinic because they have the employed physicians and specialists. So you don't lose that relationship there. But those are the things that we help you navigate through is can you keep your doctor? Can you keep your specialist? And then we help you make that decision of do I move forward? Do I stay on original Medicare? Because again, a lot of the Medicare Advantage plans do offer, the additional benefits that I don't get with original Medicare. That dental plan I need, you know, I need four crowns or dentures. I need that coverage. I wear glasses. Some plans give you 200, 300, 500 in benefit. I don't have a car. I can't drive anymore. I need transportation. Some of these plans offer transportation. A gym membership. Maybe I'm 80 and I still work out, right? And that gym membership, I can't afford a $40 a month. So joining a Medicare Advantage plan provides me that for free. Um, the benefits go on and on.
Okay, so that makes sense. I guess I kind of want to ask about how you go about keeping this simple and or manageable for a client. And let me preface that question by saying my mother, as I mentioned, is 89 years old. Her ability to firmly grasp and understand the options that are available, the decisions or choices that she made, sometimes in her case, as many as a decade ago. How do you go about making that simple and manageable for your clients? And I assume that, sorry, another two-part question. And I assume that an annual review which I'm encouraged to do repeatedly through these commercials during the open enrollment period. I assume that's an important part of that. But can you speak to simple and manageable for a client?
Correct. So I think it starts with asking the right questions, right? So I'll give you a story. I had a client that came in 2 days ago and she was really anxious because her Medicare supplemental plan was going up by 19.8%. It was going from 300 and change to about $453. And she's on a fixed Social Security income. And in the same stroke, her Part D plan went from about $24 a month to about 109 in January. So now she's going to pay over close to $600 a month, and it's almost unaffordable. So I started with, who's your doctor? who are your specialists, right? With your doctor, do you ever self refer? Because again, the beauty of having a Medicare supplemental plan is that you can self refer outside of your doctor and network. Okay. So her answer was no. And she is I think she was about 78 years old. So her answer was no, I never self refer. Will you ever? I will never self refer because I don't know how to do that. I follow my doctor's lead. Well, her doctor happened to be in a medical group that contracts with several Medicare Advantage plans. So when we went over the benefits of the Medicare Advantage plan and then the additional benefits and the cost zero, that's the direction we went in because it made sense to her. It made sense for her not to pay almost $600 a month because she got more benefit with the Medicare Advantage plan than she did with her Medicare supplemental plan. She got to keep her doctor and her specialist, and her prescriptions were covered. So that's one scenario, right? So keeping it simple starts with asking the right questions. And then, the difference between original Medicare, Medicare Advantage, and Med Sup, we try to keep those as simple as possible.
Okay.
And then I know it was a two-part question, but I forgot the second part.
Well, I assume that so the I guess second part of the question is the review part, right? So,
Got it.
how do you stay involved with clients over time as their healthcare needs change? Is that a predetermined meeting that happens every year, or or do you find yourself having to convince folks that they need to look at it again? What's that like for you?
So we take a proactive approach at HRBC Insurance. So if you're my client, you're going to get a letter. And again, we have a lot of agents, but every agent sends out and we do it for them. It's called our companion program. You will get a letter with my information on it stating, "Hey Norm, thanks for having me as your agent. These are the changes for 2027. We include a meeting flyer. So if you want to hear about the changes, you come to one of our meetings. That's the group setting. Or if you want an individual meeting, call my office, schedule an appointment. I still visit people. I have a handful of people that don't drive, so I still go to their home, right?
Right.
So they're close to my heart, and I love taking care of them. That's why we do what we do. But most of my clients love coming to my office. They get free coffee. But yeah, that personal plan review is extremely important, especially with the changes to Part D. So with Part D, there's deductibles now on some Part D plans. The benefits have changed. Your, prescription could have moved from tier 2 to tier 3 or tier 3 to tier 2. If you're a diabetic now, what plans are out there that cover diabetics? If you gain Medi-Cal, well, those benefits and plans are different. So it's really important for people to look at their benefits, if not annually, biannually, maybe some disruption. And we had people on one certain health plan that had never shopped. And when they came out 8 years later, they were surprised by the upgrade in benefits and what they were missing out on. So it is highly important for people to take a look at their plans.
Okay. So, Henry, there's a lot of agents and a lot of options out there for folks that are approaching or currently on Medicare or one of the Medicare Advantage programs. It's kind of a softball question, but what makes working with HRBC insurance different? How do you kind of set yourself apart from those other types of organizations?
Sure. I think we care. We really do care about the people that we help. My wife is a big part of that. It's compassion over commissions. It's really caring about people and doing the right thing. And whether you go with us or not, we still help people. I have had people that come to us and they're on the right plan. And if they're on the right plan, we tell them that. We don't flip people just to make a commission. We tell, "Hey, Norm, this plan that you're on, it's perfect for you. Don't let anybody tell you otherwise, and we'll revisit next year." But If you do need help, you can still call us. Okay. If you run into a roadblock, if you need to schedule an appointment, if you get the wrong ID card, if a prescription isn't covered, then we can still help you with that. And we guide people. Again, even if we don't write the policy, we will still help you because that's what's doing the right thing.
Yeah, so that is clearly a big difference from my perspective. Um, the the question I have in terms of serving clients, with something that's so personal to them and has such a large impact in their lives. Is there something that you've taken away from all that experience that has made you better at doing it than most?
I think so. Servicing so many clients, and I've written a couple thousand Medicare Advantage apps, just sitting with them, listening to their stories, hearing their background, their needs, and actually helping them out. I think that's made us not only hasn't just made me a better agent, but made us a better agency. Because when we train with compassion, right? Always do the right thing. So yes, I think it has. Being part of the
Okay.
community. Yeah.
Okay. So how long does it this is new insight for me, but somebody comes and joins, buys a policy after having a chance to sit down and learn all about the different nuances and so forth. Do clients stay with you over a long period of time? Is it an industry where there's lots of turnover because of all the
Mm.
ads and things like that? Talk to me about that a little bit.
I think there's a little bit of both. We have a lot of clients that we've had almost the 20 years that we have been in business. I know Karina has clients that we still visit. I have clients that I still visit. Like, yeah, we have long term clients. There is a little bit of turnover. I always advise clients if you see a TV ad or get a phone call and it seems too good to be true, call us because we know, right? And the reality is we do lose some clients to those ads, but then they lose their doctor or they're paying higher copays or they don't get that food card that they were promised. And then what do? They call us and then we fix it for them. So yeah. But I think the majority of our clients stick with us for the long haul.
Excellent. Okay, so you mentioned wife and said the name Karina, so I'm imagining those two things are synonymous with one another. From a from a business perspective, just a little insight into the organization. Do you both have very separate roles that you perform within the organization, or do you both kind of do the same thing for all of your clients?
So as an agent, so we both help people with their Medicare and we both run the company, but she specializes in covered California. She's a
Okay.
rock star. Yeah. I don't focus on covered California. I focus on employee benefits for companies. We have a couple of cities, some big companies, small companies, and I think we're very good on the employee benefits segment of insurance. We can save a company money. We have the inside knowledge of how does group insurance work with Medicare? Why do you have Medicare eligible people on your policy? That increases your premium. So if there's companies that need help with that, call us. But yes, I focus on employee benefits, Medicare, running the company, relationship building in the community with employers, with health plans, with medical groups. She focuses on compliance, marketing, covered California Medicare. And then we both help our agents because we do have over 100 agents that we help train, get certified to do what we do. And that is, show compassion for the community and help people with their Medicare uncovered California.
So Henry, is that a big part of your evaluation when you're recruiting agents to join the organization? You know, how you assess their alignment with your core principles, and I believe you have 10 core principles, if I'm not mistaken. But
We do.
yeah. So what is the role? How important is that assessment before bringing somebody on board?
Yeah. So there's so many different personalities when it comes to agents. And I think the ones that stick are the ones that do follow our core values and help people because we help them, right? We help the agent that's actually going to focus on your mom and take really good care of your mom. Um, so yes, that's really important when we bring on an agent, when we decide to invest in them and train them and get them certified, then yes, those are very important features that we look for. And then
Okay.
also, we're involved on community boards. We sit on a few charity boards because giving back is really important. We sponsor the local senior center. We pour a lot of money into that senior center because we believe in it and we believe in what they do for the community senior. We adopted elementary school. It's called Christmas in the Classroom. We did this 15 years ago, where HRBC buys about 900 presents and we wrap them and we show up with Santa and we do an assembly. And every kid walks away with a smile and a toy because in Title One communities, there might be some kids that don't get a Christmas present. So those are some of the things that we go above and beyond in doing for our community.
Well, as a member of this community and a participant in many organizations myself, let me just say that I appreciate that. And I know it benefits all of us in the community as a whole and different segments in particular. I do have one more question, but is there a question, Henry, that I haven't asked you that you think I should?
My family,
Let's talk. Let's talk about your family.
we're a family run organization. We treat our employees and our agents like family, but personally, we have four children, two together, but four total. We have three granddaughters and a new daughter-in-law because our one
Congratulations.
son got married. But yeah, that's it.
Okay. Okay, so last question, if I may. If someone is approaching that Medicare or approaching Medicare in general in terms of age, and it's time to start making some decisions when they're unsure about their current coverages and so forth,
Sure.
what would you say to them? How do they get started with you?
I would say call us 3 to 4 months before you turn 65, make an appointment, and we can go over your options with you, whether you decide to retire, whether you decide to keep working, and we'll help you figure it out. We are here for you. We are the expert. That way you don't have to read that Medicare and You book, which is extremely confusing.
Yes.
And we
Well,
will take the time to listen, understand your needs, and guide you with honest and caring help.
well, I think that is amazing. And you are clearly the experts because you answered several of my questions in a way that I was unable to furiously take down copious notes.
There-
So we will have another conversation offline, some coverage and my mom in particular. But I really want to thank you for taking the time to do this. I hope folks get a chance to really kind of understand the nuances and things that make some HRBC insurance different from many of the other options that are out there. I'm going to include in the description of this video contact information, phone numbers, websites, and emails so folks can reach out to you directly. And Henry Romero, thank you so much. I appreciate it.
Hey, Norm, thank you. Thank you all out there.